Good morning, everyone. Later today, I will take Bill 9, the Safe and Healthy Communities Act 2022, for second reading in the legislature. Bill 9 will amend the Health Insurance Act, allowing victims of gun violence, their families, and other connections to have access to trauma-informed counseling, as well as prescribed hospital-based and community-based violence intervention programs. With this reading, I will be asking all members of the legislature to support Bill 9 so that victims of gun violence exposure can get the support that they urgently need from their health providers. While discussions and debates surrounding gun violence has often focused on regulation and keeping deadly weapons out of the hands of potential perpetrators, far less attention has been dedicated to the impact of gun violence on victims and their connection. This has meant that significant gaps continue to exist. So at this point, I would like to invite some of my guests to speak to this issue. And first up, I'm going to ask Dr. Vaillancourt to say a few words.
Hello. I'm here speaking on behalf of a group of physicians who care deeply about this issue because we provide care to people who are directly affected by gun violence and their family, and we meet with their families and their loved ones. We have set up, I work at St. Michael's Hospital, which is one of Toronto's trauma centers, and we're setting up a program to better support victims of gun violence and their family, and this falls very much within the spirit of that kind of work, and actually will help to continue to support it. We are not a political organization. We will support anybody who does this kind of work, and Ms. Hunter here does this kind of work, and we're very happy to be here and to support that kind of work so that people like Mr. Charles can get the support that they need when those really tragic events happen and we're unable to prevent them. So it's a pleasure, and thank you very much for bringing this forward to the legislature.
Thank you for being here, and I just want to invite any members of the media who has questions for our doctor to do them now, because I believe you have to get to the emergency. Yeah.
I think I have a pretty good idea of what hospital-based trauma-informed counseling would look like, or an example that would be, but hospital-based violence intervention programs, what's an example of that?
So there's actually a network. These are programs that are already functioning in several centers in North America. Sunnybrook just set one up, and we're ready to go. And the city has actually funded our program starting this fall. And what that looks like is we have a network of peer support workers, of people who come for the communities that people were affected by these traumas, and they can accompany them to try to prevent repeat traumas and accidents or gun violence, and decrease the level of violence in the community, or the susceptibility of these members to be affected again. So that's what these programs are about.
How have they gone so far?
So there's good evidence to support these kind of programs. They're difficult in that they're multifaceted. They require really engaging with the community in a way that hospitals don't necessarily typically do. But there's great evidence that this can decrease the vulnerability of the youth, especially that we care for, that have been a victim of gun violence.
Dr. I also say that the City of Toronto supported a program to pilot this initially at Sunnybrook, and it's called the BRAVE program. And this program is seeing early signs of helping those individuals that perhaps need support to get to the root causes of violence happening in the first place, and helping to people when perhaps they're at their most open for redirection and information to get that support. So the fact is, the consequences of gun violence are pervasive and leave marks that can alter the health choices and lifelong trajectory of children, youth, people, young people, adults, and communities. Left unsupported, these consequences become intergenerational. As provincial leaders, we must prioritize addressing the impact of gun violence on those who have been traumatized. It is time to broaden the focus of our response to gun violence to include the social, emotional, physical, and mental health impacts of those traumatized. And that is precisely what Bill 9 is designed to do. Bill 9 will provide people with the services that they need to cope. It will broaden OHIP coverage to include not only direct victims, but also their family members and connections, because the ripple effects of gun violence include community trauma that can undermine cooperation and solidarity between people. And because communities that face particularly high levels of gun violence can suffer a breakdown in cohesion and the erosion of trust. Community safety has to be a priority. I know from speaking with my colleagues and members of this legislature that this is something that we can all agree on. This is not a partisan issue. We simply cannot allow the trauma associated with gun violence to persist unchecked. By addressing such trauma through expanded services, by allowing boards of health to develop programs and services for reducing gun violence, and by declaring gun violence a public health issue in Ontario, we can take meaningful steps to building safer communities. And through Bill 9, we can do this by providing the specific supports needed to address the needs of local communities. In speaking with survivors of gun violence and with the connections of victims who have lost their loved ones, I've heard how the current situation leaves those affected on their own, with inadequate resources to deal with the trauma from the loss and the post-incident stresses. How deep disparities exist in funding, donated even by the public, and access to financial resources for support services, and how Bill 9 is an important piece to address the funding gap faced by victims of gun violence. This morning, we're going to hear from some of those individuals with lived experiences of gun violence, and they continue to live with the aftermath of this trauma each and every day. So at this time, I would like to ask Tyrone Charles, the grandfather of Cheyenne Charles, who sadly passed away as part of the Danzig shooting in 2012.
Good morning, good afternoon. Today is a day which I'm very proud to be part of it, to support a bill called Bill 9, which gives us people who've been through saddest times and most dreadful moments of our life, we get hope. And this bill represents three things: capability, responsibility, and accountability. Capable enough to be responsible enough to be accountable for our actions, because when we go through death, violence, especially gun violence, it leaves us with a scar that no one could heal, but love leaves us memories no one could steal. So this bill could give us hope that we could get memories of our loved ones that passed on. So in a way that we have a voice today. So most people, well, I wouldn't point fingers, talk, but they don't walk the walk. And today here in a bill called Bill 9, it makes us feel that there's hope for us no more. We could live again, because the pain that I feel when I lost my granddaughter, I wouldn't wish it on my worst enemy. They don't. It don't really go away. It comes. Not supposed to. And I would say today that is a pain that physically and mentally it disrupts your life. It took me 5 years to really accept, and up to this day, I get emotional when it comes to her. So, if Bill 9 can make a difference, please vote for it. Thank you.
It's very hard, and I really thank Tyrone Charles and his family for just having the courage to come forward and to tell their story, which is deeply personal to them and their family. But they're doing this because they want to provide that help for others who have been affected. I want to turn the podium over to Ali Demarican, who is a survivor of the Danforth shooting. Ali, please.
Good morning, everyone. Thank you very much, Ms. Hunter, and all of these amazing people standing with us today here. I would also like to express my huge gratitude to the purpose bring us here together. As you know, I am one of those who were in the middle of unfortunate tragedy happened Danforth back in 2018. As the time passed, I see that it is not an event that will be forgotten. And I am witnessing each day how much it affects not only me, but also my immediate surroundings and my family. During all this time, apart from a few friends and our kind-hearted Torontonians and some of our MPs and MPPs, and also our Mayor John Tory, for whom I am grateful for their supports, other than I think that me and my family has been left alone without any mental support. As of today, we are still seeing effects of this tragedy, and as a family, we can say how important to have a support for a victim of gun crimes and their close family members. I had a chance to come together with Ms. Hunter and learn about her Bill 9, and it makes me really happy that someone finally solved this and taking action. Gun crime is not only a public safety issue, but it is also a public health issue. For preventing it and for the victims, government support is very important. Most of the time, mental health is the biggest part of the crimes and most vulnerable, and has low income population of Ontario who cannot afford these kind of services, and victim of gun crime cannot work some period and cannot afford psychotherapy or counseling services. This put people's life in jeopardy, and as did for myself and for my family. After the tragedy that I had to face, I was not able to go outside, even the supermarkets, to buy food. I was not able to work for months. Our lifestyle totally changed, and we have been told there is only some limited budget for us to go get some therapy services or counseling services. And it was expected me from that I should heal within a 10 session or something. But nobody asked about my wife or my daughter, how they are doing, how they are dealing with this situation. I was the lucky one in this kind of tragedy, as I had Danforth families and the friends who supported me and helped me to heal a little bit. But there are more people out there alone and without a support. As a first-hand experienced individual, I want to thank you, Ms. Hunter, for bringing this into a table, and I kindly ask from all our MPPs to support this bill, also support and protect their voters' future. Thank you very much.
So thank you so much for joining today. You've heard from the medical community in terms of why this is important, directly from those who are victims and survivors. And my message today to the members of this legislature is, we can't wait. People are in need in our communities. Gun violence is a growing issue. It's one that is spreading, and we have to do something to assist those in need to heal. And that is what Bill 9 is here to do. So thank you so much. And if there are any further questions, I'll be happy to take those.
Have you had any conversations with other MPPs, parties, namely the government, on this?
Yes, I have been speaking directly to all members of the legislature, all parties, and I'm very hopeful today that this bill will have their support. My understanding is that this is going to be a free vote from members of the government side, and from each person that I have spoken to, they have the common understanding that community safety has to be a top priority. There are some individuals who have even suggested that this bill be expanded, and that is what sending it to committee will do. It'll give it a thorough review and an opportunity perhaps to even expand the scope of the bill.
So you mentioned it's based on the BRAVE program, and I'm just reading about this here. So people aged 17 to 30 who have been treated for a gun or stabbing injury by connecting them to a case manager to support them through their recovery for approximately 6 months. And I noticed that the bill says without any time limit on accessing the counseling, but I'm just wondering if there's anything in the bill, or if you could address the 17 to 30 age limit. I believe you mentioned that it would the bill would expand supports to people who were not necessarily directly involved, but if you could comment on that as well, and then the supporting them through the recovery for approximately 6 months.
Yeah. So what Bill 9 is asking for is to extend OHIP counseling, trauma-informed counseling, to those that have been directly affected by gun violence. There is no time limit because what we know is that while there might be an acute need initially after a situation, there is oftentimes a delayed result, post-traumatic stress, and those types of impacts. And what we're seeing is that people need access to that counseling services ongoing or at the time that they need it. So there is not a time limit. The bill also requires boards of public health to develop programs to address gun violence by declaring it a public health issue in their local communities. And an example of those programs could be those violence intervention programs through hospitals, such as the BRAVE program at Sunnybrook, which will be extended to St. Mike's because they see the value in those programs. Also, very important to our response to gun violence is really getting at the upstream supports, and oftentimes community-based violence intervention programs are designed to do just that. So we need to support those programs in communities as well. Okay. Thank you. Thanks so much for being here today, and look forward to the debate this afternoon in the legislature. Thank you.